KSBY News starts right now.
More and more couples are having difficulty conceiving, so they are seeking in vitro fertilization, or IVF. That's when an egg is fertilized outside the body in a lab. The technology has been used for decades, but as we found out, some Santa Barbara doctors are using a technology that they say makes the chances of parenthood through IVF even more likely.
What we do to help people get pregnant is, instead of just that one egg that she produces every month, we cause her to develop a whole bunch.
The patient is given hormones to make her produce more than one egg.
How many eggs do you want her to get?
We'd expect to get, we're hoping, about 10.
The eggs are then retrieved like this, using a needle aspiration guided by ultrasound.
We're looking at the ovary. The dark circles within it are follicular fluid that will contain the eggs. We're taking the fluid out. The laboratory behind you is isolating the eggs.
So what's happening on the screen behind you, are those eggs?
They sure are. Those are human eggs that were just taken out of the patient just 5 minutes ago.
Inside the Santa Barbara Reproductive Center lab, the eggs are then fertilized.
We do a direct injection of the sperm into each individual egg on this machine here.
What's exciting for these doctors is a new way of looking at the embryos. Since the inception of IVF, monitoring the embryos has been challenging.
With this video capturing, it takes an image of the embryos. It's like a movie that you can look at. You can stop the movie whenever you want, because there's certain things that they have to do at certain times. It allows us to select embryos that are doing what they're supposed to do.
He says it takes an embryo 5 days to develop, or 115 hours. But with an embryoscope, embryologists can now watch the embryos every move.
We can compress that 115 hours to a minute worth of observation with this device, and you can go, aha, embryo number 1, did you see that? Did we see that? You know, it didn't divide properly.
5 days later, the eggs are put back into the woman's body.
We usually only transfer one embryo now. And the reason is because instruments like this, it takes a lot of the guesswork out. So that our pregnancy rates are higher than they've ever been now.
Kelly Moore, KSBY News.
And according to the Society of Assisted Reproductive Technology, more than 60,000 IVF babies were born in the U.S. in the year 2012.